Can someone unmute and tell what do you feel is about the mind connection on the health and well-being? Now we saw the responses as well, isn't it? So we'll go into more.
Typically when we talk about mind, we talk about it is related to the thought because thoughts create unnecessary pressure. Being positive helps, being negative it creates all diseases.
Great, thank you. And what about the soul connection? Soul pati yaradeda solla mudiyuma? Some chat boxes also you can type soul. Okay, I'll go more in English because there are many participants who don't understand Tamil. So we'll go in English. Okay, so what do you think is the soul connection to the health and well-being? Okay, so we will see in the coming slides how the soul, mind, and body are connected. Before that, we will see some of the major questions on lifestyle disease. Can anyone tell what is a lifestyle disease? We know disease. Disease means altered health or improper or abnormal health. What is a lifestyle disease?
Our routines, habits.
Yes, so routines, habits change, so you get a disease. Very good. Anyone else? So, lifestyle disease, as Sir mentioned, health problems that react to changes in lifestyle, unhealthy behaviors, and other lifestyle factors. Anything which affects your health. For example, diabetes, high BP, cholesterol, cardiac disease, cancer are all now classified as lifestyle diseases. It's pure, though there are factors like age, race, gender, which may affect it, but the major cause factor for the present scenario is our unhealthy lifestyle. That is the reason for these lifestyle diseases. Among it, we have diabetes, heart disease. In diabetes and heart disease, we have high BP as well as fatty liver disease, obesity, being overweight, fibromyalgia, which means pain in the muscles. Now, I would request you all to switch on your video if possible and just do what? You have to bend your neck forward, backward, sideward, and this side and that side, and come to center. Close your eyes and let me know whether you have any stiffness in any specific part of your neck and which part. Please try it and let me know. Front, back, close your eyes, side, right side, left side, and if you feel any stiffness in the neck or in the back, where are you feeling the stiffness?
For me, it is in the back, just below the back neck, on
Oh,
the line of the shoulders, in the line of the shoulders.
thank you, ma'am. Yes. Anybody else?
For me, left side shoulder.
Yeah, somebody, thank you, sir. Somebody has told back shoulder line. So, these stiffnesses, sometimes when we correct the posture, it might get corrected. But even then, we are all, if you're following proper posture, still we have stiffness. That is called fibromyalgia, which is like fibrous bundles in the muscles, which are caused due to stress, and that causes pain. So it is purely a lifestyle associated disease, which is caused by structural imbalance, hormonal imbalance, toxic emotions, toxic chemical exposures. All of these diseases, the root cause is inside. There is no balance. There is no balance between the mind, the physical body, and the soul. So that is why this will affect your digestive system, your immune system, basic cellular level mitochondrial dysfunction. All of it will be, bursting like a disease, like diabetes, heart disease, autoimmune diseases. So that is going to be the focus of our talk today. So diabetes, I'm just giving you some inputs on for people who may not know why diabetes is caused. So whenever we eat food, why do we eat food? We need energy for our cells to function. In order to lift this hand, I need energy. How does this energy come? Energy comes from food. So when food, especially carbohydrates and fats, inside the body, they are broken down into something called glucose. The final molecule which comes is called glucose. So what happens is when muscle needs energy, glucose has to enter the muscle. So whenever these blood in the blood, if the glucose levels come low, it will there will be a signal from the pancreas to the liver, wherein glucagon, the glucose which is stored in the liver will enter the bloodstream, and then it will be used by the cells. For the cells to use the glucose, this hormone called insulin, we would have heard it. This insulin, which is secreted by the pancreas, is needed for the glucose to enter the cells. Now, what happens in diabetes? There can be two kinds of diabetes. Type 1 is when the pancreas don't secrete enough insulin, because the cells of the pancreas are damaged by autoimmune. Your own immune cells will attack the pancreas and destroy them. In that case, insulin does not come, and so the cells will not get glucose. The glucose stays in the blood itself and becomes diabetes, that is high blood sugar levels. This often starts in childhood because the pancreas itself is not making insulin. But the majority problem, what we are all having today, the increased diabetes, is type 2 diabetes, wherein insulin is properly secreted by the pancreas. But what happens is the cells become very resistant to insulin. They are not able to use the insulin and take in the glucose. So what happens? The cells don't get enough glucose. At the same time, the glucose remains in the blood and the blood sugar levels shoot up, and the unwanted sugar molecules in the blood creates lot of problems, not only affecting the energy but the entire metabolism, and then the liver, fatty liver, because the excess glucose converts into fats and get deposited in the liver. It causes obesity. So obesity in turn causes diabetes. Diabetes in turn causes obesity, affects the kidney, eye, everything. So type 1 diabetes, that is why they take insulin injections. In type 2 diabetes, insulin injections are given to lower the blood glucose if it's a very high, but usually managed with drugs, and actually in the starting stages can be definitely managed with lifestyle changes. So this is about type 1 and type 2 diabetes. So you have to remember, type 1 is insulin is not secreted, type 2 is insulin is secreted, but because of our unhealthy habits, we are not able to use the insulin and sugar levels increase. So what are the three things you have to remember about diabetes? A, the HbA1c test. What do you call it? Usually the 3 months. Can anyone say? The 3 months? Can someone say? Unmute and say.
3 month average.
Yes, thank you. So the 3 months average blood sugar. So what is it is? The hemoglobin, the red blood cells in the body carry the glucose. So red blood cells have a lifespan of 3 months, 180 days. So whatever is getting deposited on the hemoglobin, HbA1c, when you take every 3 months, though you, for example, when we go for the test, no, we are all very intelligent. What we will do is on the day before the test, we will eat less and go and check, okay, today the glucose levels are very well, and but doctors will not believe us, they know us. That is why they have identified one test called HbA1c. That will tell you the 3 months average, because the RBCs, the glucose carrying RBCs, will be carrying the same levels deposited in them across the 3 months. So the 3 months average will be known, and it should be less than 7%. Otherwise, nowadays 6. If it's more than that, we are in diabetes. Otherwise, we are not in diabetes. And when diabetes is there, mostly people will have accompanying high BP. So it should be maintained less than 120/80. And cholesterol and diabetes are interlinked, because the excess glucose, which is not getting into the cells, will also cause increase in fat, fat anabolism, and builds up the abnormal and unhealthy fats in the body. The LDL, triglycerides, all of the metabolism is altered, and that is why cholesterol levels also increase. So we have to maintain all of these three for proper sugar control. And then next comes the heart disease. So heart disease, why we spoke about diabetes and then heart disease? Because when we have diabetes, when we have high BP, finally a person will end up in heart disease. These heart disease are all in the textbooks in the theoretical level. Heart valve, heart infections can be there, heart failure is there. But what is a heart attack? When the blood supply to the heart. See, heart supplies blood to the entire body and the brain. But when the blood supply to the heart itself has a block, there is a block in the blood supply to the heart, and that block, so that the heart will not get enough blood to pump, then the heart goes for attack. It gets called myocardial infarct means clot. So there is the heart cannot pump, and that's why we get heart attack. So what do? So if the clot is small, they will remove the clot and they'll put a stent, an artificial tube for the blood to flow. Or if it's going to be a big clot, then they have to do bypass grafting, wherein they will take a tissue from another vessel and then they will, or muscle, and then they will use that to bypass. What is a bypass road? You don't go through the main city, you outer city you go, right? So if there is a block here, they'll connect from here to here. So that's called heart attack. So this is also a lifestyle disease. And now, because this webinar is for men, what would be the difference between heart attack in males versus females? So here I've given in males, first we'll concentrate about males. In males, it will be sudden onset of the signs and symptoms. When you get a heart attack, for men, it will be sudden. For women, it will be gradual. By meaning of gradual, there have been women who have got, who have got these symptoms over a day also. But for men, usually it's very, very, very abrupt and acute. Within 1 hour or so, not even hard, within minutes, they will get these symptoms. There will be sudden sweating, or any one of the symptoms alone can also be there. That is why we should be very cautious about any one of these symptoms. There will be a tightness in the chest. There will be somebody hitting on you and pressing on you. Gastritis pain also might mimic heart attack, but you should always go to a doctor whenever you have a center of the chest pain. And there will be pressure, and there will be, you'll feel short, you'll feel that something is suffocating you. And nowadays many are complaining of tingling painful sensations in the shoulders, which radiate from the shoulders to the elbows or to the entire arm. And then you will have sometimes some people will have only nausea, dizziness. So these are for males. For females, again, it will be different. Importantly, when you have diabetes, these symptoms may be suppressed. It's called silent heart attack. Diabetic patients may not have the typical symptoms of a heart attack, and so it may be silent. And then BP. So we all know 120/80 when we measure using the BP machine. It's nowadays they even go up to 140/90 because the world itself has thought people are not going to change. Let us increase the blood pressure to 140 and 90. Above that, if it is there, then let them at least start taking medication. So 1.13 billion of the 7 billion people have hypertension. And in nowadays it's very, very, very common in youngsters. In men, especially young men, have so much of high BP anyway because of the stress factors. And what are the risk factors for all of these? Salt consumption, then low intake of fruits and vegetables, which Dr. Amuda will be covering, saturated fat and trans fats, being overweight or obese, harmful use of alcohol, lack of physical activity. We all have become couch potatoes. And so all of these, when you have high BP, it's not only about having high BP, which may cause you being irritable and tensed and all that. It will definitely affect your heart. It may cause stroke because when there is high blood pressure, there is every chance that clots will form. It may lead to kidney failure, retinal problems, and other complications. And cancers in men, I'm telling one by one lifestyle diseases. So these are the most common cancers in men: the skin cancer, lung cancer, esophageal cancer, kidney cancer, bladder cancer, prostate, testicular, and blood cancers, leukemia. Colorectal cancer, which means in the intestine when you have cancer, pancreatic cancer, then non-Hodgkin's lymphoma. It's again a type of like blood cell related cancer, liver and bile duct cancer. So now we have seen, okay, all the diseases we know, ma'am, already. We are just refreshing. But what are the factors that affect your mind, body, and soul? The uncontrollable risk factors we cannot do at the moment. Maybe when all of these, advancements come in, you can change all of it. So with race, family history, and all that takes a place. But controllable factors, high BP, you can control if you follow a proper diet and follow exercise. High cholesterol, you can control by diet and exercise. And then let's see, the poor diet and physical activity, definitely you can change. Cigarette smoking, alcohol smoking, any form of tobacco, you can definitely stop. And overweight and obese, you can definitely change. And diabetes also. So these risk factors of lifestyle diseases are controllable. And if you want to lead a proper healthy life, you can. I have left the major risk factor in men. Can any guesses what is it? Why men are getting all of these diseases higher than women? Which was also in one of the questions you answered in the beginning of the webinar. Can anyone say? What is that one major risk factor that has been found in men? That's the cause for all of these lifestyle diseases and critical factor.
The lifestyle.
Lifestyle, yes, sir, it is lifestyle, but that risk factor. We are getting some chat also.
Because of responsibility.
Yes, very good. Yes, sir. Responsibility and stress.
Stress.
Yes, it is stress. And in men, stress is a silent struggle because we have always thought men should be strong, men should not break down, men should not, share their emotions. So stress in men, this actually a kind of an article which was there. It comes as denial. First, when you ask any man, they say, I'm not saying, I don't have stress. That is the first one which they will say. No stress, ma'am, no stress. Everything is manageable. They'll not come out and tell that I am stressed because we have been taught men should be strong. Emotional blunting, they become very blunt to their people around them. Displacement of conflict and unhealthy coping mechanisms. Men are very prone. See, women at least ask for help more than men. But men go for overeating because you don't know. When you are stressed, you eat a lot. When you are stressed, some people for stress, they overindulge in exercise. That is also not good for the heart. And heavy drinking or using drugs or getting addicted to porn. These are the ways, according to this research, which says men cope up with stress, not the healthy ways of coping. And this is an article which was published in 2000. It's a 20 years before. Why do men get more heart disease than women? Men's coping with stress is less adaptive. They don't cope with stress physiologically, behaviorally, emotionally. All of these things, men are very, very prone to combat stress in a silent way. In that process, they lose their health. Okay. So what are the common physical symptoms of stress in men? Headaches. When you keep getting headaches, but you don't find the cause, it can be stress. Muscle tension, digestive problems. Constipation is a very, very, very common problem these days. Fatigue. I'm always tired, ma'am. Though I sleep well, I'm always tired. It could be stress. Difficulty sleeping. And then feeling overwhelmed, anxious. I'm worried about everything. Irritable, disconnected, mood swings. One day I'll be very happy. The next day I'll be very, very sad. And then behavioral symptoms, irritability, withdrawing from social events. When the family calls, no, I won't come anywhere. I don't want to see those people. And then drinking, doing drugs, smoking, very impatient, struggling to manage responsibility. See, you all know that I'm very appreciate all the men here because you seem to be very, very responsible men, and that's why you have put social responsibilities are the major cause of stress. So because of stress, you will not be able to manage the responsibilities properly. So these are the causes of stress, and stress is the one of the most major factor of all lifestyle diseases. It's been proven time and again. How stress affects diabetes? For example, when I'm stressed, I don't like to do anything. Okay, because psychologically I become very depressed. So I have poor decisions in managing my glucose levels. I don't follow. I will say what the doctor is saying. I know I will cope up. Even medicines, there are men who don't want to spend on medicines because that money they want to use for their family works. Okay, so that is actually good, but you have to take care of your health. So these glucose levels are managed. Managing of diabetes becomes increasing difficulty. Feeling of helplessness comes in. That increases the stress, and glucose also increases the cortisol levels in your blood. So all of this becomes a vicious cycle. Again, in heart, I don't want to go into the intricacies. When there is stress in the body, constantly your body will be in the state of an inflammatory response. It will be in process of inflammation that causes immune dysfunction, vascular problems, which affects the heart, which affects the blood vessels, which affects the autonomic nervous system, again, which affects the adrenaline, again, it affects the cortisol. It becomes a vicious cycle. And this is for cancer. Anything stressful, anything inflammatory in your body over the years will cause cancer. You can take it from me. If you go and take the history of a person who has been recently diagnosed with cancer, most of the times, I'm not telling all the times, most of the times there would have been a severe stressful environment or stress to the person. Okay. So especially in men. So don't take stress so easily. So this is what everything is increasing. Okay. If you take anything, everything is increasing. Okay. The total diagnosed cases of diabetes from 2000 to 2021, heart disease, we all keep hearing every other day somebody having a heart attack at a very young age. But we keep telling that we should manage stress, we should manage lifestyle, but we don't take proper steps. And world's highest rates of oral pharynx cancers and gallbladder cancers are in India. And gallbladder, oral, and pharynx cancers are more common in men. And COVID-19, this is an illustration. We were all very happy doing properly, at least to some extent, having proper 3 meals. Even they were calling it as breakfast, lunch, and dinner. Now they are calling meal one and meal two and late night meal. I don't know in what category we can put. So they have not put it as dinner also. So this study was not even done in country like India, where we are very poor in maintaining our health because we don't care about our health much. This was done in Japan, where people care about their health very much. So you can imagine the level where the world has gone. So they found that metabolic dysfunction associated fatty liver. When you have diabetes, when you have BP, if you take your ultrasound, everybody nowadays has a fatty liver, grade 1 or grade 2. Okay. So this is due to all of this: improper meals, no physical activity, increased alcohol intake, and gadget addictions. All of it, which again leads to all of this binge eatings, and late night Swiggy deliveries have increased across India. So these are the lifestyle changes before and after pandemic. And stress we have already covered intensively. So importantly for all of this, you are what you eat. If you eat well, you are good. But what is the connection? That comes to you are again, I want to, before I go to that important factor, I want to tell, when you are having diabetes or when you're having cardiac disease, people, the doctor will tell, don't take too much salt. Okay, it's because salt is a very critical factor, because with sodium only glucose gets reabsorbed in the body. So when you take more salt, there will be more taking in of glucose, okay, unwanted glucose. So that is why it affects the blood pressure, it damages the blood vessels, it causes hormonal changes, it leads to a constant state of inflammation, effects on the immune system. I'll come to the next part, and then calcium loss from the bones. So all of these affects the lifestyle and causes diseases. And how food affects you? Again, we eat ultra processed food, which can causes overweight, obesity, gut microbiome dysbiosis, insulin resistance, and then inflammation, and again, all again and again and again. So stress is one part, what you eat is one part. So that those things will affect the lifestyle diseases. Now I'm coming to the most important factor on how what you eat affects you, because more than our genes, more than the DNA in our body, the genes in our body, the number of bacteria in our gut is so high. 10 to 100 trillion bacteria exist in your gut, and they are your barriers and protectors. Always remember, if you have a proper gut, if you have proper bacteria, all these lifestyle diseases can be managed. Some people will be taking diabetic drugs for years, but their HbA1c will never reduce below 7. Why? Because their gut microbiome is still not corrected. So unless you correct the gut microbiome and manage the stress, whatever medicines you take will not work. So that gut microbiome or your bacteria, and I again and again keep telling this example in many occasions. You would have heard, when we eat curd rice and lady's finger bindi, like no, we get very intelligent. We do max well. Why is that? Because curd has good bacteria and the lady's finger has the prebiotic. It produces food for the good bacteria. That is why there is a gut brain axis which connects directly from your stomach and intestine to the brain. If you eat proper food, then only you can be intelligent also. You can be good cognition. Nowadays they have told that even for depression and stress, if you correct your gut bacteria, you can overcome stress. And with proper physical activity, you can have a good bacteria. So these are the factors which affect the good bacteria. Stress is one of the factors which will cause bad bacteria to grow, and pathogens will cause bad bacteria to go. But good things like exercise and some probiotics, diet will cause betterment of this, or making it worse. So this is the wellness wheel, where you have to have proper social wellness, emotional wellness, spiritual wellness. You have to have a purpose in life, because this is where the mind, body, soul connect to the health happens, where the stress and the gut bacteria and our body becomes aligned. When you have spiritual wellness, you should connect with God. You should have a meaning of purpose in life. You should have intellectual wellness. You should expand your knowledge and skills. Physical wellness, make an environment well, Be satisfied and contented with what you have. You should have personal satisfaction with your occupation, social wellness, all of this. Neha ma'am and Amuda ma'am will be covering. So we have two aspects to now. We saw the diseases, we saw how stress affects, we saw how gut bacteria affects, but what are we going to do about it? About the habits part, after Dr. Amuda ma'am speaks about what you eat part, that is the naturopathic remedies, Neha Bharatwaj will be speaking, and that's all with me. We'll have the questions at the end. Thank you. Namaste.
Yes, namaste all. Very good evening. Am I audible?
Yes, ma'am.
Am I visible? Am I audible? Yes, thank you, ma'am. So thank you, Preeti ma'am, for that very explanatory session for us. So that was actually very interesting and interactive. So I'll just share my screen. Yeah, is my screen visible to everybody?
Yes, ma'am.
Yes, ma'am. Thank you, ma'am. So today I'll be talking about naturopathy for physical and mental wellness in men. So before I start with, I just want to know from the participants who've joined today, what is your understanding of naturopathy? What does the word naturopathy say to you? What does it convey to you? What kind of medicine do you think naturopathy is? Yeah, you can just put it in the chat box, or you can unmute yourselves and you can tell me. Yes, anybody?
It is basically with managing without medicine, right? Natural, how we
Okay.
manage it. Yeah.
Okay, managing without medicine is one answer. And I,
Basically, our food we
veggies
take.
and fruits.
okay, food we take, yes. Okay.
Yeah, vegetables and fruits.
Okay, vegetables and fruits. We are getting yoga and exercise. Yes, okay. All right. And I'm just looking for just one word, which Preeti ma'am was emphasizing on her session actually today. Just one word. Massages. Yes, all these are different forms of treatment in naturopathy. But holistic way of treating disorders, yes, that is a very, very apt
That is
expression.
curing, body curing itself.
Body curing, okay, natural process is also right, but just one thing which ma'am was stressing about today. What kind of disorders were we talking about in the last session? Yes.
Managing
Swaminathan sir has
stress.
got it, lifestyle. So naturopathy is basically a lifestyle medicine. Yeah. So we will be advocating you as to what kind of lifestyle changes you can make, which can have a better effect on your health. So depending on your body, we will be prescribing you what kind of lifestyle schedule you'll have to be following for the betterment of your condition. And naturopathy, by holistic, we mean that we treat your mind, body, and your soul as a whole. So we consider the whole person rather than just your physical body or just your mind. We consider the entire mind, body, and soul being as one whole person. So we basically treat the whole body as it is. Yeah. Okay. So moving on to the next slide. Just a second. Okay. So first form of treatment in naturopathy will be diet, hydration, and herbs. So diet and hydration are actually the baseline treatments in naturopathy. So the very basic things which people need to follow on their everyday basis. So first talking about diet. So the first thing will be a balanced diet rich in fresh fruits, vegetables, whole grains, and nuts. So, how many of you are actually taking fresh fruits and vegetables and whole grains and nuts on an everyday basis? Yeah, can you just raise your hands, or ma'am, I'm taking these vegetables and fruits on a regular basis, whole grains on a regular basis. Anybody? Any hands are raised? You can even unmute yourselves and say, yes, ma'am, I'm having it. Nuts, okay. Good. That is very nice. Anybody, fruits, vegetables?
Yeah, just vegetables. Yeah.
Okay, okay. All right.
Fruits, vegetables that too boiled, not fried.
Good. Okay. Anybody who has raw salads along with your meal? I'll be very happy to know if anybody is following raw salads. Jayalakshmi ma'am is having fruits. Very good. Veggies, of course. Veggies, of course, I'm asking in the form of raw. Only vegetables as curry. Okay. Raw vegetables, anybody who has a salad along with your every meal? Okay, fine. I've got enough answers. Thank you. So why exactly are fresh fruits and vegetables in your diet very important is because your fresh fruits and vegetables, when taken raw, that is as a whole, they are rich in a component called as tryptophan. So this tryptophan component is very important for maintaining your gut. Yes. So the gut health, which Preeti ma'am was talking about in her session, is actually one of the major reasons for any lifestyle disorder. So if there's an imbalance in your gut health, you are prone to lifestyle disorders like diabetes, hypertension, cholesterol, etc. Yeah. So fresh fruits and vegetables, very basic, very simple things, but they need to be had in every meal of yours to ensure that there's this tryptophan component getting inside your body to maintain not only your mental health but also your gut health. Yeah, this tryptophan is also a very good mood stabilizer. So you're frequently experiencing mood swings, if you're frequently getting angry, if you're frequently getting stressed. So this particular component called as tryptophan is very important in maintaining your mood swings or maintaining a very well-balanced mental state and also a well-balanced gut health. Whole grains and nuts. So whole grains and nuts they are actually very much rich in antioxidants. Yeah, they're rich in omega-3 fatty acids. You must have heard this compound. Yeah, so this particular omega-3 fatty acids are actually very good antioxidants. So by antioxidants, I mean, so you have free radicals in your body. So our body is made up of cells. The cells are made up of the electronic molecules. So they are also present in the shells. We would have read in our chemistry classes. Yeah. So on the outer shells, you will have some free radicals which are actually moving around every particular cell. So what happens is when there is a less number of antioxidants in your body, this free radicals, which are on the outer circle of your cell electronic structure, they get oxidized. So that is called as free radical oxidation or free radical damage. So once that happens, that is one major risk factor for developing any kind of lifestyle diseases. It is a very much a risk factor for developing hormonal imbalances and also many other lifestyle diseases. So to prevent this free radical oxidation, one of the baseline treatment would be having whole grains and nuts in your every meal or in your everyday diet. Yeah. So that was my first point. And second is, yes, the same thing. Foods rich in omega-3 fatty acids like walnuts, flax seeds, pumpkin seeds, sunflower seeds, chia seeds, your dried fruits and nuts, all are rich in omega-3 fatty acids. And magnesium like spinach and almonds. Magnesium is very, very important for men, particularly because it helps to maintain the muscle mass. First thing, it helps to reduce the stress. It is a very good stress reliever, especially for men. And also protein intake. Protein intake is for building your muscle strength. Yeah, it is not just about the energy providing, but it is also about building a good muscle strength. So having a very good muscle strength will also in turn give you back a very good physical and just bodily strength. So that is also there when you have a proper amount of protein in your diet. And lastly, yes, eliminating processed foods and refined sugars. So by processed foods, anybody can give me examples of processed foods, very basic term, processed foods. What are the processed foods which are available in the market? Any examples of processed foods? Anybody?
All the chips, biscuits, ma'am.
Chips, biscuits, yes, very good. Noodles, yes. Anything else? Okay, fine.
Anything that is not in the raw form.
Anything that is not in the
Raw form.
raw form, okay, but not exactly, because we cook our homemade meals also, no? So those don't become processed. Yeah. Okay, pastry, pizza base, everything these days. Nice answer. I like Malini ma'am's answer. Everything these days is processed, which is almost, yeah, it is also true, because nowadays everything undergoes a lot of process of adulteration to meet the demand, which is being caused by the need of the people. Okay,
But
so
when you cook, sorry, when
yeah,
you
yes, sir.
cook actually in today's environment, even the food we cook at home, right? A lot of people don't cook the right way. Like for example, when we fry, when we use oil, though it is, we can say it's homemade food, but it's not healthy. Right? Typically, you
Yes,
give an
yes,
example of
exactly.
salad.
I'll be coming to that. That is a very nice point. Thank you, sir. So I'll be coming to that. I'll be talking about the oil intake, etc. So when as sir says, when we deep fry it, when we, just fry it nicely in oil, coat it with nice masala and maida, and then we bring it up and we have it for the taste, that becomes processed, even if it's home cooked. So that is a very valid point. So these processed foods and refined sugars are present in all of our caffeinated drinks, all of our pastries, all of our, your pastries, your cakes, your ice creams, all of those are refined sugars. Yeah. So what happens when we have this processed foods and refined sugars is there is something called as insulin resistance, which is happening in your body. So what is this insulin resistance? So when you eat a normal meal, what is the end product of the meal? Once you have a normal meal, what is the end product of the meal? What is the molecule which gives energy? What is the compound that gives energy to the body? Anybody? After you have a meal, the food is broken down and it is
People
taken
should
up by the body
answer.
as
I gave the answer in my talk. People should answer. What is that final?
Glucose.
yes, exactly. What is the end product of meal? Yes, glucose. Swaminathan sir has the right answer. Glucose, yes. So whenever we have a meal, the end product is glucose. Okay. So for this glucose to get metabolized by the body or utilized by the body, we have one more important component which is responsible for uptaking this glucose, which is secreted by our pancreas. What is that component's name?
Insulin.
Insulin. Yes, exactly. So this insulin is responsible for uptaking the glucose, which is given as a byproduct from the meal which we have. Okay. So let's say, for example, this insulin has 4 branches to which 4 glucose molecules can get attached. This is your insulin molecules. So 1, 2, 3, 4. So 4 glucose molecules are getting attached. Okay. And then the 4 glucose molecules will be taken in and they'll be metabolized. They'll be turned into energy. I'm just giving it as an example. Okay. Now, what happens when we have so much of processed foods and so much of refined sugars? The level of glucose molecules in your blood shoots up, but your level of insulin molecules is just standardized. Okay, so what happens? Every every insulin molecule can have only 4 glucose molecules in it. So when there is an excess glucose molecule, there will not be any kind of insulin to uptake those extra glucose molecules, as a result of which the glucose molecules will keep circulating in your blood itself. So that basically is called as insulin resistance, which is a very prone thing for you to develop any kind of hormonal imbalances, diabetes. And because of this insulin resistance, there is always a presence of cortisol in your blood. So by cortisol, I mean it is the stress hormone, which Preeti ma'am was talking about. Stress is one of the major reasons for our lifestyle diseases. And for stress to occur, insulin resistance is also one of the major diseases. Because of insulin resistance, the cortisol levels are always high in your body, always high. Yeah, it's not just high only during the meal time or during the digestion time. Once there is excess glucose in your body, once you enter into a condition called as insulin resistance, your stress hormone, that is your cortisol, it stays up all the time, all the time. And that is why we start developing this lower tummy pouch. All of you agree with me? All of us have this lower tummy pouch. Yeah, that is because we have somewhere at a point of time, we have been having too much of processed foods and refined sugars, or nothing but too much of complex carbohydrates. Yeah, so we should always be mindful of what we eat, mindful of how we plan our meal and what exactly goes into our body, which I'll be talking about next. Okay, and the last point in diet will be something which Preetima mentioned, that we'll have to limit when we have hypertension and cardiac disorders. What did Preeti ma'am say that we'll have to limit when we have hypertension or cardiac disorders? Anybody? It's just a very simple thing which we use daily in our kitchen.
Salt.
Salt.
Yes, exactly. Salt. Okay. Yes, salt. Correct. So, why should we limit salt? Preeti ma'am had already given one wonderful explanation as to why we should limit salt. Yeah. But according to naturopathy, why we'll have to limit salt is because salt causes something called as water retention in your body. Okay, by water retention, I mean the water which has to go out or get eliminated from the body stays inside the body. As a result of which, this water retention causes a membrane around the organs of your body. Okay, so if this is your organ, the sutti, it has a membrane, water membrane is formed. So what happens when a membrane is formed? It's going to put pressure on that particular organ. And once there is pressure on that particular organ, the organ's function will get disrupted. The organ will not be able to function that effectively. Yeah, so salt causes water retention, which puts a pressure on the organ, which will disable the organ to function effectively. So maybe try limiting your salt intake in general, not only for those who have hypertension or those who are prone to cardiac disorders, but everybody can actually limit your salt intake. I'm not telling do not have salt at all, because salt is also necessary to maintain the electrolyte balance of your body. But you can limit it. Say you're using 1 spoon of salt per dish or something, you can reduce it to 3/4 spoon or even half a spoon. Yeah, that would be the regular required amount of salt per day for an average individual. So moving on to hydration and detoxification. So hydration is very basic. How many liters of water per day is advised for an average adult?
3 liters to
3
6.
liters. Yes, very good. Okay. Yes. So as sir said, 3 liters, so 3 to 3.5 liters of water. Proper hydration is very much essential for the body, because 70% of our body, just like our earth, is made up of water. And water is very helpful in flushing out the unwanted substances in our body that tend to get accumulated if there's any disruption in the elimination process. So if you keep drinking water, there'll be proper elimination of unwanted toxins, unwanted materials from your body, which will actually prevent a lot of diseases from coming into. In naturopathy, we believe this accumulation of toxins, which is also called as toxemia, is what leads to inflammation, which Preeti ma'am was talking about was the major cause of disease. And to prevent this inflammation, these toxins need to be removed from the body. And for the toxin removal, proper hydration is very much necessary. And proper hydration is also very, very essential for your brain function. By brain function, I mean for your mental health. So the more dehydrated you feel, or the more dehydrated you are, the more you tend to have mood swings, the more you tend to have stress, the more you tend to have panic attacks. The more hydrated you are, the toxins are released, your mind is calm, you're calm and composed, you have a very clear thinking, your brain has the proper hydration. So the concentration level, the memory power, everything is straight and clear. Okay. All right. Next is detoxification. So under naturopathy, we have detoxifying treatments like herbal teas or fasting under supervision. Do not try fasting on your own. Always take the help of a naturopathy physician, because every body is different. Every body's fasting schedule or pattern will be different. So they'll be able to analyze you and give you a proper fasting schedule. And so all this will actually help you clear out the toxins. Yeah, so herbal teas also, we have certain herbs specific to certain individuals, like, those who have hypertension, those who have diabetes, we have certain herbs which will actually help in detoxifying. So detoxification is also one of the baseline treatments for curing any kind of particular disease. Herbal remedies, especially for men, ashwagandha and brahmi. So ashwagandha and brahmi are two major important herbs, especially for men. They do have they do have equal benefits for women also, but for men, basically, they tend to regulate the major hormones in your body, especially for men-related hormones. They tend to regulate the hormones in your body. They also tend to have very good immune supporting function, and also they also manage stress and anxiety. So this ashwagandha and brahmi, they are actually available in different forms in the market. Like basically, they are available in the form of powders. So these powders, they might suggest you to mix it with honey, have it in the form of a semi-solid paste or something. So it depends again. For some people, they will advise tea depending on your body. For some people, they'll advise the powders. So there are also herbal remedies which can help you combat the stress and anxiety, and also your hormonal imbalance if you have any. So next we have this 5 R's approach. So Preeti ma'am was talking about the gut microbiome, the gut health axis, the gut brain axis. So from this we understand that our gut health is very important. Okay, so you have 5 R's approach to treating your gut microbiome per se. So the first is remove. Okay, so the remove is, we'll have to remove anything that is irritating the gut. So in naturopathic view, it is the toxins. The toxins tend to accumulate, the toxins tend to inflame the body, as a result of which the gut's harmony will get disturbed. Yeah, so first we will have to remove or detox whatever is causing the or irritating the gut. Okay, next is replacing. So if there's any digestive element, or if there's any disharmony between the elements in the gut, we will have to replace them. Okay, so we'll have to take in foods which we have been missing in our diet that is causing the irritation of the gut. So we are supposed to replace our foods accordingly, so that we get back the health of our gut. Next is reinoculate. Reinoculating the gut microbiome with good bacteria. So whenever there is something irritating the gut, what would have happened is the gut microbiome would have got disturbed. So as a result of which, once you remove whatever is irritating your gut, you will have to bring back the bacteria which have been disturbed. So for that, you are supposed to have prebiotics and probiotics, which we will be seeing in the coming slides. And then repair. So once your gut bacteria is restored, automatically the damaged intestinal cells, because intestine is also, it's a part of your gut system. So those cells will also get repaired. And then rebalance. To prevent all this from happening again, we are supposed to rebalance our lifestyle. Yeah, depending on however we'll have to modify our diet, we'll have to do a regular physical activity to enable this good gut health to be prolonged for a longer time. So this is 5 R's approach. Yes. So I was talking about probiotic and prebiotic foods. These are some examples of probiotic and prebiotic foods. So by probiotic foods, we mean the foods which have the bacteria in them. Okay. And by prebiotic foods, we mean that the food which help the bacteria to grow. So two kinds of food: probiotic foods which have the bacteria, prebiotic foods which are the food for the bacteria in your gut to grow healthily. Yeah. So some examples of probiotic will be your paneer, curd, idli, dosa, buttermilk, etc. And your prebiotics will be your green bananas, your radish, cabbage, garlic, onion, apples. All these will be your prebiotic foods. So how do we plan our meal? Just an example. So you have a round plate, out of which 40% of your plate will be fruits and vegetables. Fruits and vegetables in any form, preferably raw. Yeah. So if you're having fruits and vegetables, 40%, so 20% will be for your raw salads or your raw fruits. 20% can be for your cooked vegetables. Again, cooked, by cooked, I mean steamed or just normal, the tawa thing, which we do, the normal shallow fry, but not the deep fry. Yeah. And then 25% of carbohydrates. 40% of fruits and vegetables, 25% of carbohydrates, 25% of protein. So carbohydrates will be your rice or roti, which you're taking. 25% of protein can be your sambar, your dal, your paneer, your cheese. All these are forms of protein. Yeah, so 25% of protein and 10% will be your fats. By fats, I mean the oil or the ghee which you use for cooking. Yeah, just 10%. So 10% will, I think, will come around just one small spoon. So per dish, it will just be one small spoon of oil or butter or ghee, whatever you're using. So 10% only will be fats. 40% will be your fruits and vegetables, 25% carbohydrates, 25% protein. So this will be your ideal balanced diet or an ideal food plate or a meal plate. Along with this, you can have, like, say, probiotics. So 250 ml of buttermilk if you're having buttermilk, or 100 grams of curd. So that does not mean if you're going to have curd, you're supposed to mix it with rice. No. So 25%, in those 25%, if you're having sambar rice, if you're having rasam rice, if you're having curd rice, that is fine. But 25% for sambar rice, again 25% rice for rasam rice, again 25% for curd rice, that is not the thing, because the carbohydrates level will keep increasing. So 25 plus 25 plus 25, it will go up till 75%, which is not the ideal diet. So within the 25%, if you want to have sambar rice, if you want to have rasam rice, if you want to have curd rice, that is up to you. But only the 25% of carbohydrate should be there in your meal. And if you want to have rasam, you can drink it. If you want to have buttermilk, you can drink it. But if you want to mix it with rice, split your rice into 3 and then have it in that itself. Have it in the 25% itself. So this will be your balanced diet. Right? Okay. So this is our RDA for men. So by RDA, the full form, does anybody know? RDA. You would have heard this, you would have seen this in all of the packets which we get. RDA examples, I mean RDA full form, I'm sorry. Anybody? Anybody who knows the full form of RDA? Yes, I think we got an answer. Recommended dietary amount, almost right. It's actually recommended daily allowance. Yeah. So recommended daily allowance for men, basically. So we have different age groups: 11 to 14, 15 to 18, 19 to 24, 25 to 50, and then 51 plus. Yeah. So the calories is nothing but the total energy you need per day. So it varies from age to age. From 11 to 14 is 22,500 kilocalories per day. And then if you see from 25 to 50 years, you need 2,900 kilocalories per day. Like that, same for protein. It's like 45, 59, 58, 63, 63. So vitamin A, vitamin D, all these is just a rough idea as to how many kilocalories, how much amount of protein you need per day as a man, and depending on your age group. Yeah. Right. So coming to yoga. So before moving on, I would like to know, what does yoga do to your body? Anybody has idea what does yoga do to a body? What kind of what kind of activity is yoga? Is it just a physical activity, or what does it exactly do to your body? What is your understanding of yoga? Have you seen it? Improves flexibility. Okay.
Focus.
Improves focus. All these are benefits. So what exactly does? So what kind of treatment is yoga to the body? Like, is it only to the physical body, or is it only to calm yourself, or how is it? What is it? Mind and body, sings mind and body, body and mind. Exactly. So yoga is a
Suman Ram sir has something to say, ma'am. Yes, sir.
No,
Please.
no, I was
yes,
just saying that, the slide that Dr. Preeti was mentioning about the first slide, right?
yes,
Mind, body,
exactly.
soul. That is
Yes.
where the integration happens.
Yes, exactly. That is a very, very wonderful answer. So, yes, thank you all. So, yoga is one physical activity which unites, or, which synchronizes the balance between your mind, body, and your soul. That is the way in which yoga differs from any other form of physical activity. Yeah. So, when you practice yoga regularly, it just not only improves your physical health, it improves your mental health, it gives you clarity in it, and it also connects you spiritually. Yeah, so it is a meal or a treat for your mind, body, and your soul all together. So you get benefits for all the three in just one practice. Okay, so some of the poses like child's pose, cat and cow pose, Shavasana, Virabhadrasana. All these are actually relaxing poses. Virabhadrasana is specific to male because it's called as the warrior pose. It tends to strengthen the most what to say the entire muscles, especially for males. Yeah, so all these poses, and then I'll be talking about some more poses also. So these poses, the child's pose, Marjari Asana, Shavasana, all these tend to relax your body. So they are majorly for your mental well-being. Virabhadrasana is majorly to strengthen all of your major muscles of your body. And then pranayam techniques like Nadi Shodhana, Brahmari, all these tend to balance your nervous system. They tend to reduce your anxiety. Then they also tend to enable you to have a more deeper breath. The more deeper breath you have, the more proper immune function you will have. That is a proven research that says that regular practice of pranayama will actually enable you to have a very deep breathing. So as you have a very deep breathing, automatically your immunity or your body's health in general will start to increase. So by this deep breathing, I mean, how long does a tortoise live? Anybody has any idea? How long does a tortoise live? Anybody can answer this. How many years does a tortoise live? Any idea?
More than 100.
More than 100, yes, exactly. And why do you think that tortoise lives for so long? More than 100 years.
Because
Why?
it breathes less per minute. Less.
Sorry?
Breathing cycle is less per minute.
Yes, exactly. The breathing cycle is less per minute because it takes a very deep breath. Yes, it is very slow. It has a slow breathing. So by slow breathing, we mean it is a deep breathing. So it's a deep inhale and a deep exhale. So in yoga, if you had experienced any classes during pranayam, they would have told you take a deep breath in, take a deep breath out. So why is it? That is to slow down your breathing. The more slower your breathing is, automatically the more healthier your body is, the more longer you live. Yeah. Pranayama. Pranayama, if you cut the word, prana is life. Ayama is to increase. So pranayama, regular practice of pranayama is to increase your lifespan. Okay, so that is what the word literally means. So the more deeper your breathing is, the more better it is for your health. So regular practice of pranayama will actually help you achieve that deeper breathing. Yeah. And then meditation and yoga nidra, these two are wonderful techniques to calm your mind, to focus your mind, and also your physical body. Any kind of stress you had throughout the day, at the end of the day, you sit and meditate for a few minutes, or you sit and practice yoga nidra for a few minutes, you will see that stress just flying away. So meditation and yoga nidra, try inculcating these practices in your everyday schedule to experience the benefits which has. Okay. So this is yoga at desk. So I saw in the question which Preeti ma'am had asked, like, what is the major source of stress for you? I saw a lot of people had answered professional work pressure, or office work, etc. So at your office, at your desk, These are some poses which can be practiced to release the tension in your muscles, in your physical body, in your joints. Because of prolonged sitting, you might experience a lot of muscle aches, your joint aches, your mind will be very dull just looking at the computer screen. So these are some poses which can be done just from your office chair itself, so that you can move your body every 1 hour once for 5 minutes, just go for a walk, take a break. All these just at office techniques which can help you manage your office stress. Yeah. So your work pressure can be managed by simple yoga techniques like these and simple pranayam techniques. Okay. All right. And then moving on. Yes, hydrotherapy. So by hydrotherapy, we mean treatment with water. Hydro means water, therapy means techniques. So hot baths, jacuzzis, cold showers, cold water immersion, contrast hydrotherapy, steam and sauna, food soaks, relaxing baths. All these are actually very, very helpful in ensuring proper blood circulation to your body. So once there's proper blood circulation to your body, what happens is your body's blood flow is normal. Once your body's blood flow is normal, there's proper vital nutrients and oxygen going throughout your body, which helps you to relax and rejuvenate at the end of the day or even the starting of the day. Yeah. And then aromatherapy. Aromatherapy is also called as smell therapy. Yeah, so these oils, peppermint, lavender, lemon, eucalyptus, bergamot, rosemary, cedar wood. So all these oils are actually easily available in the market. So you get a small bottle. So you can just use these oils even at your workplace or at your home in the form of use them in the water in which you take bath. So these oils, they tend to have a lot of components in them, phytocomponents, which help to relax you, which help to ease your anxiety, which help to relieve pains in your body if you're experiencing anything because of the stress or because of, just general muscle aches or something. They have a lot of analgesic properties, there is pain relieving properties, de-stressing properties. They also have anxiety relieving properties, de-stressing. So these aromatherapy is a very simple technique which can be followed by everybody to, just calm themselves down to ensure a good physical health. Yes. And then aromatherapy techniques will be diffusion, like just how I told you, you have a diffuser which is shown in the picture. So you can just add 2 drops of oil in it and then you can use it as a room freshener. And then massage with dilution, where, dilution is done with a carrier oil like almond oil or jojoba oil. So you mix the needed essential oil with the carrier oil and just massage it onto your skin. And then you can use in the form of baths, or you can use the aromatherapy in the form of inhalation. So these are 4 different techniques for aromatherapy. And lastly, just a summary. So how do we maintain our mental health the natural way or maintain the physical health in a natural way? First is well-balanced diet and fruits and vegetables, good gut health, aromatherapy techniques, yoga practices, hydrotherapy like steam bath, sauna bath, and then exposure to sunlight. So expose yourself to natural sunlight as much as possible. After the sun rises, the initial 1 hour, or before the sun sets, the last 1 hour will be the ideal time to expose yourself. So wear a thin clothing, expose yourself to the sun for 20 to 30 minutes. Take in all the sunlight, because the UVA and UVB rays from the sunlight, when they come in contact with your skin, they tend to tranquilize your body. They tend to vasodilate your body. By vasodilation, I mean the blood vessels expand. So there's a proper blood flow, there's a proper circulation. Because of the proper circulation, there is a good oxygen levels, all vital nutrients go to each and every part of your body, which tends to ensure there's a good physical and your mental health. Right. So with this, I come to the end of my talk for today. I thank you all for listening, and over to Neha ma'am for psychological tips. Thank you all. Namaste.
Namaste and good evening, one and all. So, how are you all? How is the rain, the wind, and the cyclone in your area? Hope you and your family are being safe. So, please do take utmost measures against this cyclone Fengal. And any which ways, today evening is not about Fengal or Pengal. It is about our gentlemen, right? November is the month of mental health for men, or Men's Mental Health and Well-Being Month. And to commemorate that, we have this workshop organized. So let us go towards our workshop and the topic that I would be taking, that is the resilient man, mental strength and wellness. So you all were very active participants in telling that, okay, these are the stressors that we have, and you have been really accurate and observant about your stressors. But before we move to these stressors, this is a general question that I think most of the women will be having, that why is it that men don't speak about their mental health? Why don't they express themselves? So I open this platform for men, and I request them that they can put in the chat box as to why men feel that they don't share, or they don't share or express their feelings. What do they see as hurdles, or what do they see as a problem while expressing themselves? So men, if you can just put it in the chat box. Okay. They think people will see them as weak. Okay, Hema Malini ma'am, thank you. Men don't want others to see their weaker nature, reserved in nature. Okay. People can't accept that even men can have issues. Very true. People cannot accept that even men can have issues. Very true. Right? And let us go towards our topic. This is what even I want to start with. That is, I'm sorry. Yeah. The society has put lots of burden on men. Okay, the society expects men should be like this. You are a man up, chin up, don't cry, right? And then there are these gender related differences that has been drawn by the society for men and women. Especially for men, it is like you have to be the breadwinner, you have to earn more, you should contribute more financially in the family, towards the society. Your finances should be more than that of the women in your family, right? The second is, don't cry, don't show the expression on your face. If you do that, you are a girl, you suck, right? You cannot say sorry. Oh no, men should not apologize in public. They should always show that they are in the dominant of the situation, right? They always should have a very strong face, a very diplomatic face, no expressions. They cannot show their weakness. They cannot show their humane nature in public or even between the families, or else they might, even within their families, or they might set a bad example for the next generation. And men should always be in control of the situation. If this is the situation, the man should have an answer for it, right? These are few of the societal expectations hinders which hinders the men from expressing themselves. I hope even the men here agree. Now coming to the next point, what happens when these societal expectations come in? Men stop sharing. That is the first thing. The second is, men underplay their symptoms. So the men here can also definitely share their experiences, uh, that many a times we don't tell about our symptoms because we feel that, oh, I have to be the man, I should not be the burden, so I should not make my family tensed. So I'll not tell them that I'm having a shoulder pain. I'll not tell them that I'm having a uh, you know, a chest pain, or I'll not tell them that I'm feeling very stressed, very anxious about the current job. I'll not tell them that my boss is pressurizing me, or there is a politics going on in the office. I'll not share it. So I usually underplay my symptoms because I have to be the man. I cannot be a burden, and I have to take the burden. So that is one of the reasons as to why men underplay their symptoms, and that leads to them being isolated. Isolated in the sense they will be with the family, they will be with the friends, but yet they will not feel being a part of that place. Their mind will be somewhere else. All the family will be happily chatting, the children will be saying something, the wife will be saying something, the parents will be saying something, but the men are not able to be there mentally. Even though they are there physically, they are in their own isolated space. And what happens when this isolation starts setting in. When men are not able to connect, when they start feeling frustrated that they are not able to share, and all their emotions start piling up, bottling up, penting up, what happens? They have to take it out somewhere, and that leads to harmful coping mechanisms. In fact, a survey shows that out of 4 people abusing drug, 3 of them are men. And nearly 41% of these men have told that they have had this disorder for the past, or at least for 1 year right now. And out of 3 deaths because of opioid poisoning, 2 are male. And 37% of these men, they said that they are suffering from addiction, either alcoholic addiction or drug related addiction, because of their fathers. They saw their fathers doing it, so they are doing it. And that is why, men, it is necessary that your behavior should be proper, your these lifestyles should be proper, because men in the end of the day end up emulating their fathers. Even though they love their mothers, they will always emulate their fathers. And 3 suicides, out of 3 suicides globally, 2 are men. Why? Because they are not able to find a space where they can open up. The society has put so much pressure on them. It is like they are being kept in a invisible box made by the society, where they are not able to speak out. So, what did men have to say? So, 1,000 men were asked about their mental health, okay, by this group called as Priory, which is a private healthcare place. And out of these 1,000 men, 32% of the men said that their biggest stress is work pressure, which even you people said that professional pressure is a lot more for you. Financial pressure is high, and their health pressure is only 23%, which leads to mental health related stress. And 40% of men, they say, out of these 1,000 men, that is 400 close to, have told that they have never spoken about their mental health to anyone, because 29% said that they are too embarrassed to speak about it. I mean, what will people think about me? I'm going to a counselor, I'm going to a psychologist. Oh, that means I'm not strong enough. So the society will not depend on me. My family will start thinking I am weak. And then what they'll do, they will start trying to dominate me, or they'll start taking up the stress, and I'll become a burden on them. Right? And 20% of them say that there is still a negative stigma on the issue. Definitely. Right? 40% of the polled men said, men who have been polled said that they have tried and for suicide or self-harm. And 77% of the 1,000 men are suffering from negative mental health effects, which is not a small number. 77% is a huge number, right? So what does mental health stressors look like in men? So this work pressure, this financial pressure, what does it lead to in men? So in men, there are 4 major. It can cause more emotional problems, but there are 4 major problems that is caused in men, and that is anxiety. So here we need to understand that the anxiety in men and women are different. In men, in women, anxiety is usually fretting, oh, this has to be done, oh, that has to be done, oh, we have not done this, oh, they'll be all over the place. Okay, they'll show their anxiety. Men will not show their anxiety. They will rather go into a shell. Usually, men, when they have anxiety, they'll find that their thoughts are clouded. All the thoughts have come up to one place, and they are not able to pick up one thought that they want to work on. Sometimes they feel stuck. They feel there is a blank space somewhere. That is how anxiety looks in men. They are not able to move forward. They sometimes are standing at one place, not able to know where to go next. Next is depression in men. In men, depression is very much similar to that as in women and children and elderly people. That is being into a room, not talking to people much. But then again, these are somewhat similar, right? I mean, most of the men don't speak much. Men speak to their friends, men speak to their family, but overall, like women, they don't go on chatting, right? So many times depression in men goes undiagnosed because when women don't speak, it is very evident they are not speaking, and they have gone into a shell, they are enclosing themselves into a room, they are constantly looking into mobile. These depression signs, they are very easy to identify in a woman, but in men, because they have this similar behavior throughout the day, or many a times in the day, it is very difficult to find out depression in men or diagnose depression. Okay, now here comes a question for which I would like everyone to answer. Have you all heard about postpartum depression? If yes, then can you please type in the chat box who has postpartum depression, men or women? If you can type in the chat box, women after giving birth, okay. Postpartum depression. Is it only, okay, I have received one answer. Any more answers? Okay, thank you, Hemamalini ma'am. So postpartum depression is not there only in women. Postpartum depression is also there in men. Men also suffer from postpartum depression. In fact, men also undergo hormonal changes during their wife's pregnancy. And this is proved. And that is why men also have mood swings during their wife's pregnancy, but it is never being talked about. It is always about women's moods, it is always about women's hormones, and never about men. Right? In fact, men during the course of pregnancy also develop men's breasts, also develop they call it as a paunch, that is the underbelly. And these are because of the hormonal changes which they share with their women. They also have that motherly affection coming up, which helps, which I would say manifests in their body in this way. And hence, men also have postpartum depression. Once a baby is born, the men might not have postpartum depression as women have it from hormones. For men, it will be more like, oh, now I have to be a father. Oh, now I have to be an idol. I should be an ideal father. There are financial stressors. Then there are how to take the family ahead stress, and that leads to postpartum depression in men. But it is never spoken about, and it is, you see so many Hollywood, Bollywood actresses speaking about postpartum depression in women, but never in men. So that is one thing, that depression in men is scarcely spoken about and hence has very less awareness. Similarly, PTSD, that is post traumatic stress disorder. Trauma is any incident where you lose someone, where you undergo a situation which has been very stressful, that it has become a part of your subconscious and you are not able to come out of it. You witness an accident, or you witness any crisis, or you witness your own job loss. So these things are called as trauma. And because men don't speak about it, in men, post trauma stress disorder is very high. When they lose their parents, they don't cry, which is a very sad thing because that is what the society expects out of them. And when they are not able to cry, they have this unresolved grief in them, which later on comes in form of trauma that causes stress. And like Preeti ma'am and Amuda ma'am have already spoken about the effects of stress, right? It starts affecting their health. And similarly, bipolar disorder, because of all this anxiety, na idu pannuma, adu pannuma, should I do this, should I do that, it leads to bipolar disorder. That is, either they are too happy, like Preeti ma'am was mentioning, or the mood swings, or they are too depressed. It is on the two ends. It's never in the center. It also happens. So now let us come about why men's mental health is important. And the irony is, mental health cannot be without men. Even the word mental health requires men. If we remove the men, it will just be dull health, right? So men As much as the society places importance on women's health, a man's health is also mental health, physical health is also very important. Because I speak as a woman that if I am sitting here speaking, it is because my father thought it was necessary that my daughter should get good education, she should have a good career. It is because my husband thinks that my career is important and I should have my own life. It is because my in laws feel that my career is important. They say that it's because of a supportive brother. They say that behind every successful man, there is a woman, but behind every successful woman, there is her whole family, and especially the fathers, the husbands, the brothers who have kept that much trust on their wives, their daughters, and their sisters. So, men, if your mental health is not strong, if you are not strong enough, if you are not bold enough, we women cannot step out. There are many sons who are advocating for their mothers, second innings of life. Mom, you have lived out as ever you want to live. Now you should live your life for yourself. Your health is important, Amma. Right? There are so many brothers who are like, you go, sister, you go out and try, you can do it. As much as a woman's mental health is the pillar of the house, a man's mental health is also the pillar of the house. And every daughter, knowingly, unknowingly, takes in the personality of a father. And every son ends up emulating their father. So your mental health, your physical health is important because you are needed for the family, for your professional work, and for the society. So, for that, what should we do? How should we take care of our mental health? So, these are the symptoms. Preeti ma'am already mentioned the symptoms. So I'll just be running through it. In men, unlike women, anger, irritability, and aggressiveness is more of a symptom. Changes in mood or energy levels, feeling fatigue, tired. Then, like ma'am said, changes, both the ma'ams emphasized on change in appetite, not feeling like you should have food or feeling like you should have lots of food, difficulty in focusing, like we were discussing, sometimes you feel stuck, you are not able to focus or concentrate, feeling restless or on the edge, something is not right, I don't know what is not right, I need to find that out. High alcohol consumption and drug consumption, then participating in risky activities, like maybe something risky in the sense like bungee jumping. Suddenly you are trying, out all bungee jumping, all mountaineering, because somewhere you want to prove yourself that you are not as low as you feel you are. Feeling hopeless, sad, numb, flat, having physical symptoms like aches, pains, having obsessive compulsive thoughts. Same thoughts are coming in again and again. Thinking or acting in a way that would concern yours or others' life in a negative way. That is, you start becoming a negative persona in the family or in the society and thinking or attempting about suicide. So let us come to this point. This is the main last 10 minutes of this webinar. What can we do? Ma'am, you spoke about everything, ma'am. Yes. But now what can I do? What is the solution? Okay. So here comes the first part. So for this, if you all have a book and paper next to that is book or paper with a pen next to you, I would ask you to take it and start writing whatever we discussed so that it would be useful for you. Or if you have a mobile next to you, you can also type in the mobile. And this is not only for men, it is also for women. So you can also do it. Okay, so all the participants, I request you that you write the few things that we would be discussing next. So if you have a mobile, you can also type in your mobile and send it as as a WhatsApp to you yourself. So first is know your emotional states. So if I were to say, which are your three major emotional states that you are usually in? We are in many emotional states, but which are the three major ones that you are usually in? Like if somewhere someone was to ask Neha, which would be Neha's major emotional states, she would either be happy, she would either be angry, or she would be sad. So these are my three emotional states. What are your three emotional states? If you have a pen and a paper, please do write down. I give you a minute. think, and write is what are your three major emotional states? Is it anxious? Is it feeling low? Is it feeling energetic? Is it anger, irritation? Is it frustration? Is it blaming? So, what are your three major emotional states that you are in? You can have many, but we'll focus on the three major ones. Now, coming to the next part, I hope you all were able to write the three major emotions. Next is what triggers you. Okay, so these are the triggers that cause you to have those emotions. You feel excluded when you feel excluded, that people are not including you in their teams, in their meetings, in their, is that when you feel angry, frustrated, irritated, anxious, when you feel powerless, or when you feel that people are not hearing you, you want to say but you are not heard or valued, you feel you're constantly being scolded, judged. So write down the five major triggers that you feel that lead to these emotions. So you have a list here. It can be something out of the list as well. So which are the five major triggers? You couldn't speak up when you felt you wanted to share. You feel lonely, ignored. You couldn't be honest. You felt like you are the bad guy, people are making you the bad person, or you felt that you are forgotten, that no one values you, they don't remember your birthdays, you feel unsafe, unloved, unfair, frustrated. Which are the top five triggers that leads you or causes these three emotions majorly? You feel trapped in a situation, you are not able to come out. You feel lack of passion. You feel uncared for, manipulated, or you felt that you are being manipulated, you are being controlled. So which would be the top five triggers that cause these emotional problems? So if you have written these five, now let us come to the next part. Okay, now you know your emotions, now you know your triggers. Okay, now how to work around them is what we are going to see. So for working on your emotional management, the most important thing that you need is your support system. People who would be honest with you. Can you write the names of three people in your book, pen, paper, mobile, whatever? Three people who would always be honest with you. They would give you total honest feedback. Can you recollect, remember any three people who would give you honest feedback? Write down their names. Okay, these three people I can depend on. They will never put sugary coated words. They'll never put this tappu na tappu, sari na sari. Can you write the names of three people whom you can talk to when you are stressed? It can be, these people can be your friends, your neighbors, your family, your relatives, or maybe someone who travels with you to your office in the bus or the train. People whom you can talk to, three people when you are stressed, that you want to vent it out. And you know these three people will always be there to listen to you. I hope you all got your three people who will give you honest feedback and whom you can contact when you're stressed. The third one is people whom you could call in an emergency. It can be a medical emergency, it can be a flood related emergency now, it can be any sort of, you don't have a what do you say? You are stuck in a situation where you're not able to step out of the house. Then whom can you call? Three people. Now, whatever you are writing, this is your support system. Knowing that there are people out there who are there for you instills confidence in us. It gives us, okay, I need not worry. There are people for me, and things will be taken care of when I need it. or even if I'm not there. So we should know the support systems. And next is we should make, so before we end this, I would also make a note there. If now that you are aware of your triggers and now that you are aware of your emotions, whenever you see that, okay, this thought is rising in me that I'm not feeling a part of the team. So this will make me feel down. This will make me feel low. You can immediately go to your support system. The moment you feel that, okay, I feel no one prioritizes me, no one loves me, no one, then take out that list. There are people who are giving you honest feedback. That means they care for you. There are people who you can talk to when you are stressed, when they'll come running for you in an emergency. That means you are not uncared for, you are not unloved for. There are people like that for you, right? So whenever you see a trigger, you know that that emotional response will be coming up, run to your support system. Okay, that is why we had this small activity done. So hope you all have that paper and this will serve as you for your emotional regulation and management paper. Next is make time. Next important thing to for men to avoid these stressors is hobbies. So men, can you just type in the chat box saying yes that you have what do you say, a hobby at least which you practice at least once a week. Once a week, ma'am, I do practice a hobby. And this is my hobby. Yes, I do. So can you type in the chat box one hobby that you follow at least once a week? More than once? Good. Oh, okay. Gaurav ji is saying cooking and gardening. That is wonderful. So others don't have any hobbies currently. Cycling, sports. Okay. Good. Sports, Raj Kiran ji is a very big term. Sports, as in what do you usually follow? Do you play cricket? Do you play badminton, tennis, or football? That's nice. Wonderful. So, as three men have only put it, I think that only three men have a hobby. I think there is someone else. Yes. Oh, practicing music and Veena. That is wonderful. So, if you see only three people or three men and of overall four responses we have got, that means let it be men or women, we are not practicing our hobbies. More so ever for men. We don't have hobbies, we don't have time for our friends because we are always workaholic. We are always busy with our work. We don't have time. Okay, so making time for hobby, how much? At least once a week, at least Sunday, at least those 2 hours, men you deserve for yourself. At least weekly once catching up with your office colleagues, or monthly once catching up with your college friends or childhood friends. You will be surprised that when you do these activities, your stress levels will go down like anything. You will find a satisfaction in you. And similarly, that will lead to you not using any unhealthy coping habits. Having a hobby, listening to music, catching up with friends. Because knowingly, unknowingly, when you are with friends, you tend to ventilate, you tend to share, right? So that brings down your stress levels and that leads to you not having any unhealthy coping. So please do make time for hobbies. Please do make time for friends and families. Playing with your children also will give you a sense of satisfaction. And similarly, adaptive coping strategies. So when you are in a situation where you feel, oh, how can I come out of the situation? Think of four things. What actions can I take? Now, in the situation, like I'm in the situation, what actions can I take? Shall I plan something? Shall I collect more information, that is reading about it? Shall I observe how others are doing it? Shall I ask others? Take action. Men usually are very good in taking actions. But next part is when it comes to options available. Like, okay, now I'm not able to cope with the situation. I'll go out, I'll do some distracting work, or I'll restructure how I think. I will not think என்னால முடியல இதுக்கு இப்போ time இல்ல, or minimization, acceptance. These things are the friends where usually men are lacking more than women. But there are many men who are good at acceptance as well. But still, as compared to men, women, men usually lack in this. And resources, men drawing help from the resources like contact seeking. Contact for professional will seek, but never for our own self. Comfort seeking, finding out any instrumental support or spiritualism. This is usually, spiritualism is actually good in men, but comfort seeking, reaching out to the societies for help, that is usually less in men. And similarly, how can I comfort myself? Emotional, can I express it? Can I change my behavior? So these are healthy ones rather than eating or drinking alcohol or smoking a cigarette. So these adaptive coping strategies, if you can remember, will help us during our emotional regulation related problems. Similarly, breath, as ma'am was also saying, pranayama, breath, that will help us to regulate our emotions to a very great extent, and taking care of our own self, which was also emphasized by Dr. Preeti. It can be physical health, mental health, or emotional health. And Dr. Amuda also mentioned it, that when things get difficult, that is when we are emotionally stressed, when we are emotionally under anxiety or anything, we tend not to take care of ourselves. That is why you see in office hours we drink least amount of water, because we are so stressed about that work that we don't drink much of water. That is why it is necessary that we put alarms and drink water. Put alarm every 1 hour that I'll drink water. One half glass of water I'll drink, or one glass of water, depending upon the size of the glass, I'll drink. Sleep is important for me. Let the world think whatever they want to think. I'm going to sleep. Okay. So that these small actions will actually help us have a better health. And similarly, having any daily movement. It can be as simple as standing in one place and jumping. It can be walking. When you get a phone, ma'am, I don't have time, ma'am. Okay, you get a phone call, start walking in your office. From here to there, you walk. Some movement will help you get better sleep and it will enhance your mood. If you can give 30 minutes to 45 minutes daily for any form of exercise, definitely it will enable you to release more endorphins, which will resolve the cortisols that Amuda ma'am and Preeti ma'am were talking about, and it will also increase your mood. It will elevate your mood, and you'll feel better. So daily movement is compulsory. Either you walk, either you do skipping, you do yoga, you do exercise, cardio, gym, whatever, cycling, going out for a walk, anything. And similarly, spiritualism. Spiritualism is nothing but spiritual. What does the word spiritual mean? That means rituals for your spirit. These rituals can be religious if you are God loving. You pray to God, that is one spiritual way. Or it can also be going in the nature, going for a walk in the nature. Means don't go and sit in a wildlife, please, I'm not talking like that. Maybe sitting under a tree, or just standing in the balcony, or if you have plants at your house, drinking coffee near the plants. These are also small rituals that you can do for your mind. And similarly, altruism, helping someone out. If you can be associated with any kind of NGO or anything, definitely very good. But no, I cannot work with an NGO. My time doesn't permit me doing small acts like maybe if you have a junior who doesn't understand work at all, is being a trouble, be patient and teach him. You will have the satisfaction that okay, I'm uplifting a child, uplifting a junior. Or maybe you can support your maid's children's education, or some sort of altruism. It will give you a purpose in life that Preeti ma'am was talking about. And having a purpose in life automatically enhances our mood, makes many a times we feel down, no, we start having self doubts. At that time, spiritualism and altruism will help us. With this, I'll conclude today's session. Thank you so much for your patient listening. You have any doubts, we are a free medical guidance system. You can call us on this number for psychological counseling. We provide very affordable counseling at 300 rupees. If there are people who cannot afford it, you can ask us to call them. Students, it is free. For single parents, it is free. For non-working women, it's free. So you can definitely call us. And for naturopathy and yoga, we have regular yoga classes in Gopalapuram. You can definitely call us on these 3 numbers and we will reach out. Thank you so much. Over to you, ma'am.
Thank you so much, Neha ma'am. Thank you so much, Dr. Amuda ma'am. So the bottom line is you have to balance. There's no other way. For men, you have to balance your mind, body, and soul because you are the core of the family, which is the unit that forms the nation, that forms the world. So you have to take care of yourself. Don't hesitate to ask help. It can be the support system of your friends, what Negama mentioned, or it can be the support system of like such counselings which we provide, because it'll all be very confidential wherever you go for counseling. And please go ahead, take help, maintain your lifestyle, do exercise, try to include one healthy food per day. It's very difficult to start with. I have been through that, and it one small step every day goes a long way. One whole grain every day, or one fruit, one bit every day, one fasting per month. That's how we take it forward. With this, if there are no questions, we would like to conclude the session.
Requesting everyone to kindly fill the feedback forms because your honest feedbacks will help us improvise. So please give your feedbacks in the feedback link, which is put in the chat box.
And further topics, if you wish to us to touch upon any topic as well, kindly give your feedback. And we have shared the WhatsApp community chat link as well. Do join the community. We keep sharing about such webinars, which you can share with other people as well who would benefit from it.
And also to add on regarding the yoga sessions, we have offline yoga sessions at Gopalapuram and Mogaper. And we also have regular online yoga sessions also, which are happening morning and evening via Zoom. So those who are interested, we provide it at a very affordable cost of 200 rupees per session. We have regular yoga, we have therapeutic yoga like Jalneti, Trataka, Yoga Nidra, which is happening.
Yeah.
So I
It's
would
200
request all of you
per
to
month.
Yes, 200 rupees per month. You can attend both online and offline. You can attend any number of sessions in that 200 rupees per month. So those who are interested to join and experience the benefits at such an affordable cost, please contact the Naturopathy and Yoga helpline. We would be more than happy to help you. So please start
Start with the
practicing.
yoga session. At least once a week, you can attend the online session.
Yes.
And once you experience the benefit, you yourself will join. So one session per week. Okay,
Yes.
please take it as a challenge from today. And then the new year is coming. We are all very good with resolutions. Let's start the new year with yoga. And I hope the resolution continues.
Yes, the New Year Eve month also should be with yoga, ma'am, not just New Year. New Year, we have one more month. So New Year Eve month, the last month of 2024, we'll start with our resolution then.
Yeah. Thank you. Thank you. Namaste all. Namaste. Everyone.
Namaste all. Thank you so much.